The commonest complication of fibroids in pregnancy is what we call red degeneration. Red degeneration simply means that the fibroid itself undergoes certain changes which may make the woman to start having significant painful episodes that may need her to get to the hospital and be hospitalized in that regard. And treatment is usually that of giving drips, that's IV fluids, and some safe painkillers that is not harmful to the baby or the mother. Over 2 or 3 days, the pain will usually subside, reduce, the woman will be discharged. There's a likelihood that this may also occur in the same pregnancy after some weeks or some months. The treatment is still the same. As long as there's someone to care provider that will help to mitigate or reduce these pains, we're almost certain that we'll get to the end of the road and the baby and mother will be fine at the end of the day. Certain fibroids, because of their sheer size, when not detected before the pregnancy occurred, will now remain with the pregnancy. Fibroids don't grow as much during pregnancy, but the baby will grow at a point very fast. And because of the presence of the fibroids and the baby in a small compartment, even though the womb tends to expand, there's pressure by the fibroid on the womb in this case, causing increased pressure, especially of the water surrounding the baby. So towards the end of second trimester or at the beginning of the third trimester of the baby, in this case between 6 and 7 months, there may be episodes that may cause contraction to start, or in some cases water breaks. And when that happens, it is almost certain that the baby will have to be delivered after some time, possibly a week after. So that's the major complication in this case, when you have a big fibroid that coexists with pregnancy. Remember that in pregnancies that have complications, especially in this case of a coexisting fibroid, 9 months is not the goal. Even at 8 months or 8.5, once the gynecologist or the obstetrician feels that this baby can come out without jeopardizing the health of the mother, in this case, that decision is taken and baby is delivered. When the fibroid is big beyond a certain size, it is advised for a woman that is trying to get pregnant to get it removed, because of the problems that may come with a pregnancy staying with that kind of fibroid during the pregnancy itself. So treatment option in this case is remove the fibroid, then the pregnancy journey will now be initiated or started, so that the complications that may arise from the fibroid being there when the pregnancy is already in place is removed entirely. Surgery is not always needed. The goal of treatment is management is to make sure that this baby and mother are safe at the end of the day. So monitoring is key. If there are any complications that may arise, they are taken care of. Then pray and hope that the pregnancy progresses beyond the maturation point. When this happens, a decision to deliver the baby is made, because the more you wait, the chances of a more serious complication may arise. So deliver the baby, then at a later time, the fibroid will not be removed. So that when the lady or the woman is planning for another pregnancy, this complication or these problems will not arise again. That will be all for today. Till next week, when we continue to address your health and fertility concerns. Don't forget to subscribe and turn on your post notification to get updates on our new videos.